Now for the final presentation, for the final group is going to be disability and mental health. And what we'll have here is a presentation by Sue Kilminster. And Susan is, hold on a second, she's a lead for the health professional education research in the Faculty of Medicine and Health, and she'll be accompanied by Hosina Otmir. Please.
It's just me doing this presentation. I'm going to say a little bit about some of the themes we talked about in relation to mental health in the workshops we've had as part of this network during the last year, and then give you a brief outline of a project we've got going on within the faculty or within this university around mental health. So, mental health is supposedly a priority for everyone, supposedly for the Department of Health. It's in lots and lots of research council funding calls. It's a priority for the council, voluntary sector, and so on, and also for research. So obviously our discussions had loads and loads of angles, and I'm picking out the things that are relevant for this network and towards thinking about these issues as a matter of inequality and social justice rather than some individual problem. So one of the really important things to always have in your mind when you're thinking about mental health is this whole issue of poverty, benefits and work capacity assessments, and now even going to these forced work cures. So in our discussions and in my own work, work is a priority, but it's really work chosen by people, not any idea of forcing people into low-paid, zero-hour contracts that they've got to do it to show they've recovered. And there's lots of critiques that show at the moment the idea of recovery, which is problematic in itself, is defined by employability, and it's employability in very poor working conditions. The other big question we had, which I'm only going to talk about in specifics today, is this whole thing about evaluation. And there's lots and lots of projects in Yorkshire, in West Yorkshire, that are quite innovative and are trying to do quite radical things. But the difficulty can be showing that they've worked, partly to make sure that we do what works, but also people need that for the funding, next funding applications and so on. They're often like small pilot projects. So we are having some discussion about ways in which we might be able to get a larger evaluation going that's got a number of small projects in it. Yeah. So focusing on work, but bearing in mind those provisos. Lots of different surveys of people living with mental health challenges have found that people say that discrimination and stigma at work is a bigger problem than their whatever challenges they face. The studies vary. And also there's some research that shows that using all these biomedical models, biomedical ways of like collecting together a group of symptoms and giving people diagnostic labels actually makes discrimination and stigma worse. And so we really don't want to go down that road. And the other side of that is all this thing about trying to get change. It's in all aspects of policy, not just in relation to mental health, of this individual behaviour change approach, where the person, and other people have said this, the person or the people experience oppression, they're the ones who've got the problem, they're the ones who need to change. So one of the things is that shifting from thinking about that individualised approach to understanding what goes on as oppression. I've put stigma in inverted commas because some people don't like using the word stigma in relation to mental health difficulties, because the argument is that it individualizes the problem rather than putting the problem out there. It's a debate, so that's why I put it in inverted commas. But whatever, it's about the research is around trying to move to more social models of understanding and working against oppression. So, at the University of Leeds, in the Faculty of Medicine and Health, we've had lots of problem with discrimination around mental health and other health issues. And it was decided that we needed to do something about this, have some sort of training, some sort of action. And so you can see, hopefully everybody there can see, that the aim was around raising awareness. It was about inclusion and trying to reduce discrimination and stigma and trying to improve the work environment. First of all, we put out a call. It was regional. It was a public call for training providers to come and do some training on that. And what we found is that absolutely all the people that put in tenders, and it wasn't a complicated thing, you just had to put in a couple of sides of A4, they were all around using these diagnostic approaches. They basically gave a list of definitions of the main biomedical diagnoses and lists of symptoms, and focused on helping the person who had that label. So we had to devise our own training, which I think is an example of people with lived experience and people with professional experience, and they're not separate, that can be located in the same person, to get a whole stream of workshops going. That was the start of a program to try and change attitudes. And at the moment, I'll give you a few points from it. 383 staff, about 20 to 25% of the staff in the Faculty of Medicine and Health have gone, and 90% of them are either positive or very positive about the workshops. And the key thing there is around changing understandings from this more biomedical approach to a more social approach. So the questions that we're left dealing with is, first of all, trying to use a more theoretical approach to evaluating such things, and using a practice theory approach, which is a way of understanding social change and looking at the different elements. So you're not left with this question of, do you try and do it top down from policy or bottom up? With using a practice theory approach, you can try and look at all the different elements that are involved in change. So that's a sort of theoretical challenge around evaluation. There's some practical ones. How do we extend this program? There are finance issues, obviously, but also the trainers we've got are brilliant, but there's 1,600 people in the Faculty of Medicine and Health, staff that is, and about 6,000, I think it is, in the university. So a little training team cannot do that. So we've got to work out other ways of how to expand that. And this whole issue of passion and academic distance, that little blob's meant to be a thing vibrating between the two ideas. It's also trying to engage with the thing of, you don't have to be distant from these things in order to have something useful to say about it, but there is real benefits in having an academic approach to it. So it's trying to get those two things working together. That's the end.